Hello, welcome everybody. I'm Gia Merlot. I'm the chair of the Lifestyle Psychiatry Caucus of the American Psychiatric Association, and these are our monthly webinars. And I'm so excited to introduce today my friend and colleague for many years, Liana Lianov. She is a global leader in lifestyle medicine and positive health, is a president and founder of the Global Positive Health Institute, GPHI, which I'm honored to be on the scientific board of, advisory board, that's right. It provides training and tools for health professionals and their patients for advancing positive health, defined as a state of well-being achieved through healthy lifestyles with positive psychology activities and a supportive environment. She also serves as the assistant professor of the Center for Positive Health Science in Ireland, I believe it, right? It's
Yes,
RCS.
in Dublin.
Yeah, Dublin. She is a key contributor to the Douala Declaration of Lifestyle Medicine developed by the Lifestyle Medicine Global Alliance. She received the 2022 Trailblazer Award from the American College of Lifestyle Medicine, and she has held numerous positions at ACLM and the American College of Lifestyle Medicine, including president, International Positive Psychology Associates Positive Health Psychiatry and Wellbeing Division president, the American Medical Association Healthy Lifestyles Division director, and the American College of Preventive Medicine board regent, and more. She shares her expertise as an international speaker and an author and editor of scholarly publications, including the books Roots of Positive Change, Lifestyle Medicine from Inside Out, and Rutledge's International Handbook of Positive Health Sciences, which I was privileged to write a chapter in. So please, without further ado, Dr. Lianov.
Thank you. Thank you so much, Gia, for the invitation. And thank you all here for being here and for being interested in learning a little bit about my worldview and perspective around this construct that I call positive health that we'll dive into. And as I do that, I will apologize in advance in that the last couple of days, my internet has been a little spotty. So you'll have to wave if somehow I freeze or something and I can go back to the previous slide, but hopefully that won't happen. So here we go. There we go. So again, thanks for the kind introduction. And yes, I have this nonprofit, the Global Positive Health Institute, which I think is the first of its kind that's looking to meld medicine and positive psychology and more, and to make this really practical for everyone, for the benefit of ourselves and our patients.
Liana, we lost you. We lost your we can't hear you. So do you want to call in on your phone? That might be a way of doing it if you're going to have a problem with the internet. We can't hear you.
You can't hear me at all?
Now we can hear you. Now we can hear you. It came back.
Okay. Well, hopefully this won't happen too often.
Okay.
So the learning objectives that I'm going to touch on today briefly are we're going to talk about a definition for positive health, the role of and definition of positive psychology and how it connects with positive health, and particularly from a lifestyle medicine perspective, this important reciprocal reinforcing relationship between health behaviors and positive emotions, and talk a little bit about how to make this practical, how we can offer positive health interventions as part of a comprehensive healthy lifestyle in order to help for ourselves and our patients to achieve optimal mental and physical health. Clearly I'm preaching to the choir. Many of you, I'm sure, are very familiar with positive psychology. It just comes down to an emphasis on human flourishing, on strengths and virtues and what's going right with individuals and communities and organizations and how to leverage those strengths in order to thrive. So what are those positive influences in a person's life and in our communities? Then from the positive health perspective, we integrate that into lifestyle medicine. So positive health definitely builds on making sure that we address traditional risk factors that lifestyle medicine does. but then we also add and promote these independent protective health factors that are based in positive psychology science. And all of that, the third component is it has to be in the context of a supportive environment as part of that biopsychosocial model. And there is plenty of evidence that why is it important to help individuals be happier? Well, we all want to be happy, however we define that. And of course, we could quibble about the terminology. But what we do know is this sense of vitality, happiness, well-being, that individuals who experience this tend to live longer. We have a lot more research to do, but the prevailing science shows that there are multiple mechanisms by which happier individuals live longer. And so I've listed a few of those. First and foremost is cardiovascular health through boosts in the parasympathetic nervous system, lower inflammation, stronger immune systems, of course, longer telomeres, better endocrine regulation, and then also indirectly through healthier behaviors. And we know people who experience life satisfaction actually have lower, for example, lower diabetes risk, which of course promotes their longevity. Just positive affect has been shown to be associated with lower mortality. And in lifestyle medicine, we've got our 6 pillars, and what these 6 pillars have in common, besides that they're foundational to a healthy lifestyle, is that in that blue box, what they have in common is they boost positive emotions, they boost a sense of well-being, and those positive emotions in turn are drivers for engaging in and achieving these healthy behaviors. So this is a really important reinforcing and reciprocal link. And oops, back too far. And there are vast amounts of data that show this link. I'm just highlighting one, which is physical activity and mood, and positive mood, as well as positive physical activity is a treatment, as we well know, for depression. In some cases, it might even be more powerful than our standard medications for depression. And that in addition to addressing negative emotions, physical activity boosts positive emotions. And that's not a one-way street. Also, those who start out more psychologically well and have that sense of vitality and happiness in prospective studies, they also tend to be more engaged in physical activity. So the science has shown that it goes in both directions. And so in positive psychology, one of the theories is this upward spiral theory of lifestyle change. And this is actually was my pivotal moment when I went to the International Positive Psychology Association's World Congress, and the outgoing president at the time, the award-winning Dr. Barbara Fredrickson, she was giving her plenary speech, and what she was talking about was lifestyle change and this link with positive emotions, positive psychology. And I looked around the room. There were 2,500 people from all sectors, human resources, education, and only a few from health and medicine. And I'm like, wow, we need to change this. This lit a fire under me. And that's one of the early steps towards my eventually starting my organization and working in this area. This upward spiral theory of lifestyle change. So intrinsic emotions that are pleasant, that are positive, that we can associate with health behaviors, then really drive us towards those behaviors. And not only that, it's an outward spiral, because it also helps build what we call vantage resources that support those healthy behaviors. And a great example of that is that generally a happier person, people want to be around that person, so they tend to have more social connections, more social resources that can be healthy and also help reinforce those health behaviors. And so that I make my own version of the 6 pillars of lifestyle medicine, where I expand that 6th pillar that's generally talked about as social connectivity, social connection, and add to it positive psychology, because Positive psychology includes that, includes relationships, as you see, but includes more. I'm specifically calling out some of these other activities and mindsets that can really contribute to a more comprehensive lifestyle, healthy lifestyle approach. And why do we care about this? For many reasons that I've already mentioned and alluded to, but particularly nowadays, we live in a society with, of course, so much stress, so much trauma, talk about the LA fires and so much more, wars, everything that we're exposed to, violence. And the modern society requires us to be not only resilient, resilience means really bouncing back, but thriving and even growing in the face of adversity, that adversity can become a good thing to propel us forward. But we have to have the resources to do that. And that's this umbrella term of positive health allows us to do that through our health behaviors, through positive mindsets, positive psychology activities, and in this supportive biopsychosocial model. So then stepping back, I think of all of those as positive health interventions. And positive health interventions are useful for so many things. They boost emotional well-being, manage stress, strengthen that mental health, mood disorder treatment. Health behaviors are supported, as I've noted. There are also direct physiologic benefits, as we looked at some of those mechanisms, social health, successful provider-patient interactions, and then this ability to be resilient, to thrive, to have a healthy longevity. And in fact, this term anti-fragility has been talked about, that we can build ourselves up so that we're no longer fragile in the face of difficulties. And another reason it's important for us to be thinking about this in healthcare and in medicine is because often we get stuck. We work on that continuum where we're helping patients from physical and mental illness to get to physical and mental health. But it's really a two continuum model. And separate from that is this other continuum that helps individuals move from diseases of despair, loneliness, stress, trauma, low quality of life, to becoming their best selves, even if they still have an underlying mental or physical condition, or their whole world is crumbling around them. There are things that can help support them along this positive health continuum. And also then with those diagonal lines, also then helps that journey from illness to health be easier and be supported. And sometimes not only is it easier, but it may be necessary to work on that positive health continuum first, because we're so stuck on the illness continuum. And then we can open up the door to greater healing, greater adherence to whatever other treatment is needed for illness and to achieve health. And so this two continuum model, which actually, in essence, I adapted from model in psychiatry that looks at that as well, in the Keys model. So this it's nothing new. It's just spelling it out a little more concretely for us. And this term positive health is used around the world in different ways. We don't quite have a standard definition. I offered my definition that I use, that also my colleagues at Royal College of Surgeons Ireland, they use that definition basically. But there are others, for example, in Netherlands that are doing wonderful work, and this is their model. As you can see there, it's a broad model, again, that biopsychosocial model, and it doesn't specifically call out positive psychology, but you see there one of those elements is meaningfulness, right? And that is in common with the PERMA model from Martin Seligman, the founder of modern positive psychology. And we know relationships and meaningful activities, there's the greatest amount of science behind those two areas in positive psychology that boost well-being. So even though we're using the same word and same term, there are differences, but there's enough overlap that I think we're all headed in the same direction. Another example is the VA whole health program, or this term of person-centered care. Whole health care is used in a number of healthcare systems, and the VA has been a leader in this. Again, as you can see in their circle of health, there are all these elements that I would call elements of positive health. But then if to tease out this particular aspect of positive health, which is the positive psychology interventions, there are many of them. I've been talking about interventions and you're like, well, what? Well, here's a list of a few of them. There's quite a wide variety of them that have been studied and incorporated into a series of meta-analyses. And they do show that despite the fact that we have quite a variety of quality of studies and a variety of interventions, if you put all that into the soup of a meta-analysis, there is still a statistically significant impact, even though it's small. But keeping in mind that variety, it's definitely significant impact on both psychological and subjective well-being, and in turn, we know that's connected to physical well-being. And so here's a few of these meta-analyses. There are now about 8 major meta-analyses. Almost all of them have shown some positive impact. There's one that was equivocal, and I think maybe the quality of the studies impacted that. And of course, we can talk more about unanswered questions and further studies that are needed. But at this point, most of the leaders in the area of positive psychology would say, without a doubt, these kinds of interventions, activities, however you'd like to refer them to, do have an impact on our well-being, and we should be paying attention. And now a simple framework that is commonly referred to is this PERMA model. Again, I mentioned that Marty Seligman put this together a number of years ago. It's been so commonly used. I know Marty now doesn't like it as much because it is a bit of an oversimplification. Positive psychology has so much more than these 5 elements, but it's a great place to start. And especially with groups that are not familiar with positive psychology at all, I often start here, and it's it's just an easy framework to remember, and it's commonly used to the point where this has become a verb, and people may ask, are you perma-ing today? Are you doing things to boost your positive emotions? Are you engaged in activities that give you that sense of flow? Are you connecting, with positive relationships, doing meaningful activities, and working towards goals that give you a sense of achievement and accomplishment? And the two, I alluded to, the 2 areas that are the heavyweights in terms of scientific evidence, of course, are relationships, that's specifically positive relationships, and meaningful activities. And there are a number of cohort, wonderful longitudinal studies that bear out this relationship between social relationships, and our physical well-being and longevity. And one that many people are familiar with are the Harvard study of adult development. Dr. Robert Waldinger, who actually presented at our recent lifestyle medicine conference and who has the wonderful book out, The Good Life, that came out last year, really highlights this study. And they have followed these individuals, these males, but eventually they've also added families of these males. They looked at the Harvard Ivy League boys as well as the inner city Boston boys, followed them over many decades, now almost 9 decades. And so they have so much information to help us tease out the confounding variables of what is it that boosts our happiness? What is it that boosts our physical health and our longevity the most? Where is the crux of it? And the single most important factor is the social relationships, positive relationships we have. And there may be many explanations, but one right out the gate, again, is these boosts in the parasympathetic nervous system, increases in oxytocin, and improved vagal tone and heart rate variability. And then meaning, there are quite a number of studies that doing meaningful activities can slow cognitive decline in the elderly, slows disability, is associated with longevity, is linked to individuals actually following through with recommended preventive care services, and so much more. And I'm delighted to be involved with the American College of Lifestyle Medicine's new project that's looking at life meaning, life purpose, and spirituality, and we're doing a literature review and looking at the evidence, and then how do we make this practical for those of us, for individuals who are wanting to teach around these concepts, as well as in medical education, as well as incorporate it in our own lives to take care of ourselves as health professionals. And then very importantly, are there practical ways to include this in busy lifestyle medicine practices and beyond, and other healthcare practices, specialty practices, including psychiatry. And I always say that give the caveat that how we define well-being, vitality, happiness, no matter what word you use, is going to vary a little bit based on your cultural background. And there is this discussion that there are two major approaches to, from an individual perspective, from a societal perspective, on well-being. And in an individualistic society, that would be our Western society, we tend to do, actually, the way we have framed modern day positive psychology, we tend to actually do better. We respond better to these kinds of interventions. Whereas in more Eastern Asian societies that are more collectivist societies, the impact isn't quite as great. It doesn't mean that it's not important, but it might be that we need to tease out the specific positive health interventions that will be useful. And some early studies show, for example, that acts of kindness are more powerful in those collectivist societies for obvious reasons, whereas, for example, gratitude practice is quite powerful and more powerful in our individualistic Western societies. So then the question is, how do we make this practical for ourselves in busy healthcare settings? Well, we're already, if we're talking about a lifestyle medicine type of setting, or even a primary care setting, we're already needing to do at least a basic assessment for depression, stress, anxiety. And we tend to, in general, well, the broader we in healthcare focus on the negative. And so from a positive psychology perspective is to, why not find out about positive emotions and positive experiences that patient has had at the same time that we're evaluating the negative, and asking about the kinds of activities that we know, we call it positive psychology activities. We don't have to use that terminology, but we can draw out from our patients the things that they're doing that are in this realm that we can then reinforce, and also reinforce their personal strengths, because character strengths is an important part of positive psychology that I don't get a chance to talk about in this brief amount of time. But there's so much we can do to start engaging our patients from this positive psychology lens. We can actually actively measure some things like life satisfaction, fairly briefly, explore new positive activities that could be incorporated in coaching health behaviors, or incorporated and prescribed as part of a health maintenance plan or a treatment plan. And so here's the Satisfaction with Life Scale by Ed Diener. He did quite a lot of work to hone this Likert scale down to these 5 statements from about 60 statements, he and his team. And then those top 3 that are bolded, if in a busy practice, there's a time, or maybe in a long review of systems, there isn't time to ask all 5, we can get almost as much predictability with the top 3, the 3 that are bolded there. And here's an example of a prescription. So we prescribe medications, and in lifestyle medicine, we prescribe exercise and healthy nutrition. We can, in the positive health realm, start to think about prescribing social interaction, prescribing meaningful activities, prescribing flow activities. And the underpinnings of a successful lifestyle medicine practice is behavior change. So incorporating and integrating positive psychology with more traditional counseling techniques, coaching techniques like motivational interviewing makes a lot of sense. In fact, probably the earliest adopters of positive psychology in healthcare settings more broadly has been health coaches who incorporate that.
Liana, we lost you for a moment, so I don't know if you can hear me, but we can't hear you right now. So, Liana, can you hear me? Okay, so let's try to get you back.
Hello, am I
Now I
back?
can hear you. Now we can hear you.
Okay,
Okay,
okay.
good.
I will start from the slide here. So the earliest adopters of positive psychology in healthcare are the health coaches who have integrated it with traditional health coaching techniques such as motivational interviewing and some cognitive behavioral techniques. And so I'm so glad that it already kind of, in essence, that is basically standard of care when we're talking with health coaches. And there are a number of beautiful studies that show how putting this into the toolkit of coaching and health behavior change can result in more successful successful behavior change models. And I cite some studies there, for example, in promoting physical activity in patients with diabetes, and also it improves body mass index and hemoglobin A1C, that they've actually compared, do you include positive psychology in your toolkit or not? And indeed, it makes that difference. And here's another slide that just takes the simple PERMA model and gives an example of how each of the elements of the PERMA model could be crafted when we're talking to a patient about a particular behavior that they're interested in working on and that we're helping them work on. And in terms of savoring positive emotions when they're doing that activity, seeing how maybe they can lose themselves in that activity, get that sense of flow. We know people who are walking or running out in nature, etc., can attest to that sense of flow. Of course, relationships, and maybe we can do these activities with others, healthy cooking with others, walking with others, and paying attention to how these activities that we're doing are meaningful to us, or how they might be meaningful to our families, that as we become healthier, we'll be there to support our grandchildren, etc. And then, of course, the very basics of health behavior changes, following positive steps forward, one step at a time, easy steps to more complicated steps, and then really celebrating the successes of each of those steps, and giving ourselves a sense of accomplishment and pride, which is a positive psychology tool, and it's the A in PERMA. And of course, it takes a village, it takes a team to practice high quality healthcare. And what I'm talking about wouldn't just be done by the physician or even just the health coaches. It's everyone on the healthcare team can start approaching patients and their interactions with each other, with coworkers, through the lens of positive health and positive psychology. And then we can leverage referrals to the community resources, and apps that are vetted, and so much more, so that this kind of work for integrating positive health into a clinical practice, it becomes more feasible. And I have to put in a word for, of course, that we have high rates of burnout with our physicians, with our nurses, and other health practitioners. And the early data, and we had done a study with the College of Lifestyle Medicine, shows that lifestyle medicine and practice helps reduce rates of burnout. And certainly everything that we know about positive psychology, although there's not been a specific study looking at it, but how we're integrating that with with a healthy lifestyle, it makes sense that that will really benefit the practitioners themselves. So even these positive short interactions that we have with coworkers, or even I know there are wards in hospitals that take a little gratitude break, or at the end of the week, they'll have a huddle and they'll integrate some positive psychology intervention to the team, and that can really go a long ways to helping with professional satisfaction and reducing burnout. And I promised to touch a little bit on research. There's so much more research that we need to do. I'm a real advocate to taking what is evidence-based in psychology and translating that into other healthcare settings, whether it's primary care, specialty care. And so what we're now doing is integrating it there, but then it's research informed. It's no longer evidence-based because we've changed the setting. So it would be lovely to now build the evidence base and see if we can impact mental and physical health outcomes in a variety of healthcare settings. Also, with a variety of populations, I made the case for differences in cultures, also demographic differences with the young and the old, really teasing out specific positive health interventions and what their mechanisms of action are, and thinking about, from a practical sense, how to meld all this together into best practices that apply that two-dimensional model of healthcare. So in summary, positive health is another term for something that's already starting to get some traction in the healthcare systems, but clearly we have a long ways to go. So, but no matter, a rose by any other name is still a rose. It's this person-centered whole health approach, includes healthy lifestyles, includes these independent health protective factors based in positive psychology science, supported by an environment, a supportive environment in that biopsychosocial model. It helps to boost positive emotions because of this reciprocal reinforcing relationship with health behavior.
Liana, the last two sentences we did not hear, but everything else we heard. So we're just at the last two sentences now, whatever you just said. Actually one sentence. So I think we're close to the end, right?
Yes, very close to the end. Can you hear me now?
Yeah, I can hear you.
Okay, great. So yes, so positive health interventions help us boost psychological, subjective well-being, as well as have those direct physiologic benefits, and amounting to greater physical health and longevity, with the caveat that we still have to tease out the cultural differences, and for different populations, we may be with further research figure out which ones are more impactful for which groups. But in the meantime, despite all that, this whole area is a promising approach for healthcare, and I do hope that and advocate for more of our colleagues in healthcare and medicine to be applying this two continuum model, where we're not only talking about illness to health, but also very separately this positive health continuum. And there are very few resources on this, and I happen to be a big advocate of this. So I've edited and helped to write some books, and this has been with the American College of Lifestyle Medicine and my organization. All the proceeds are for nonprofit purposes, but if you want to dig in deeper, these are some resources for you. And yes, please, if you have an interest in engaging with me and the Global Positive Health Institute around these topics, there's my contact. And yeah, thank you so much for listening.